Drawing from the Department of Human Services in Victoria, 2007 assertion without evidence, clinical placements in hospitals and health services represent a significant cost to services. Well, in the absence of evidence, I'm wondering what was being costed. Was it supervisor time? Was it patient services? Were those direct or indirect patient services that were provided by the students? That assertion flies in the face of admittedly old data that shows that students are not a cost in terms of direct patient care, and I do acknowledge that the longer a placement goes on, the more benefit there is to an organisation that hosts students. There are several studies in physiotherapy that show real benefits to departments in terms of occasions and amount of direct client care. And then there's a raft of studies that show all the value-adding, the indirect patient care, the tangible rewards for clinical educators, and the increased self-esteem and work satisfaction that comes from contributing to the development of future professionals. Now, I'm not an Alice in Wonderland. I know how hard supervising students is. So while I might feel great satisfaction and increased self-esteem, I do have days when I go home and want to bash my head against the wall. I want to draw your attention to this study because I think at the moment it's the most powerful piece of evidence that we have. It comes from the Mayo Clinic in the US, where they've tracked over many years what happens to clinician productivity when they work with 3 to 4 students at a time for 9-week blocks, and they do this for much of the year. I think one of the things that makes placements unproductive and a drain on services is where you have just 1 or 2 students once or twice a year. Get into the role of it, they become a real boon to a department that's hosting them. The Mayo Clinic runs a very structured program, a good orientation, goal setting. Students get to observe in the first week. They get exposed to patient care in the second week. Throughout their placement, there's a real emphasis on peer learning and other learning activities like developing in services and running them for the staff. By week 4 or 5, students are expected to be at a 50% caseload, and at week 8 at a 75% caseload, and the final week is evaluation, wrapping up and handovers. Now, where students are on placement in multiple collaborative models like this one, the Mayo Clinic data shows that the clinical educator is at least twice as productive as a clinician in the same department with the same caseload but without students. Now, it is an American study, it is a different model. What have we got in terms of recent productivity studies in Australia? Not a lot, but I'm laying the foundation at the moment for a large-scale grant application. I've already got a number of partners in play with this, but just a little bit of low-level data. They're all from physio, that's where I've started my focus. So in a private hospital, having 4 students per block for multiple blocks a year adds 14% income to the physiotherapy department from patient care and equates to 1/3 of a clinician. In a private practice, students add 20% to the bottom line, the dollar, for that clinic. And in a mid-sized public hospital physio department, they run their outpatient services entirely with student input. No students, no outpatient services, and the students contribute the equivalent of another full-time clinician.